more than we need. I'm Paul Oostenbrug. I'm an independent insurance agent, and the government requires me to say that I represent all plans available in the market, Medicare Advantage plans, except Christa St. Vincent's plans, because most people in Albuquerque are not terribly interested in Christa St. Vincent. This is an educational presentation. You probably, so I'm just going to dive right in. You probably saw news in the paper, if you read the newspaper, that Presbyterian Senior Care is leaving the market. And you might wonder, why in the world is that happening? I can provide a little bit of context for that. Presbyterian, if you think back to 5 or 6 years ago, has been trying to merge with other organizations. They tried to merge with an Iowa hospital company, and that didn't work. 2 years ago, they tried to merge with a Utah hospital company, and that didn't work for some reason. And evidently, they are again trying to merge with a Utah hospital company. Whether it's the same one or a different one, I do not know. But it was reported in the trade press that that hospital company said, Presbyterian Health Services, we really like you. Clinically, we're impressed. We like your footprint in the state of New Mexico, but you have a Medicare Advantage plan that's losing $60 million a year, and it lost almost that much last year as well. So the Utah hospital company, said, we would be happy to talk with you about a merger or some sort of affiliation, but we're not in the Medicare Advantage plan business, and we don't think you should be either, given that it's losing $60 million a year. So once you have disposed of that plan, we'd be happy to talk. Well, that's great, except for the 30,000 Presbyterian Senior Care members in New Mexico. Because, well, let me say it another way. I have always said about Presbyterian Senior Care that people who have Presbyterian Senior Care tend to like it, and they tend to remain enrolled in that plan. But if you just think about that for a moment, that means that the senior care members are probably older, and as we age, what happens? We get more illnesses, so they could have higher medical acuity and as a result expenses. I think it's probably fair to say that Presbyterian didn't do as good a job as they might have, because they certainly did not intend to lose money on that business of managing the medical risk or understanding the medical risk. But long story short, if they're losing lots of money, they're going to exit the market and nobody's going to buy it from them because they're losing money. So what does that mean for you? I initially, when I proposed delivering this workshop, I said you have options now. Well, technically you do. You will have many more options during the Medicare annual enrollment period in the fall. The option that you could technically have now is if you've been affected in some way by the drought in New Mexico, and you could claim that the drought prevented you from enrolling in the plan that you wanted to be enrolled in. So it's like if, then, so you can see that that's really not much of an opportunity for it. Anybody who lives in the city, maybe if you're a rancher and live in the country, or a farmer, or you, etc. I don't think for those of us in the city, that's a real opportunity. But what you will have in the fall is actually a rather unique opportunity. You will, of course, have the opportunity to change Medicare Advantage plans. But in addition to that, you will have the opportunity to enroll without any medical underwriting in a Medicare supplement plan. Do people understand the difference between Advantage plans and supplement plans?
No.
Okay, I will do my best to simplify it. I think of an Advantage plan, which, as you know, has Though I talked to somebody yesterday who's enrolled in a Presbyterian plan for which she pays $118 a month. I don't know why anybody would do that, but she evidently did do that. Most senior care members are in Senior Care Plan 1 or Plan 2, and those plans have zero premium. That's what most of the Medicare Advantage plan members in New Mexico are enrolled in, a zero premium plan. But as those of you who had any Medicare Advantage plan know, those plans have co-payments for the small things, never for preventive care, never for primary care. But if you're getting an MRI, there's a copay between $120 and $200. If you're seeing a specialist, there's a copay of, well, it could be as little as 10, it could be as high as 40, but it's a non-trivial copay. But the MRI at $120 to $200, inpatient hospital per day copayments of $400 to $550 a day. Outpatient hospital or outpatient surgery, typically about that same $400 to $550 per episode, if you will. Ambulance, those are co-payments on a Medicare Advantage plan. So if you think of a Medicare Advantage plan as being like going to an a la carte restaurant, you order no appetizer because you're not hungry for that. You order an entree and you order 2 desserts because you really love dessert. Well, you're going to pay for both of those desserts. And to bring it back to the healthcare field, you did not choose to take an ambulance to the emergency room and get admitted to the hospital. For your health perspective, it's good that you're getting that care, but there's a big co-payment for each of those interactions: ambulance, emergency room, hospital. The emergency room one will likely be forgiven if you're admitted to the hospital, but maybe not. And so you've paid nothing up front, but you're paying co-payments whenever you have a significant medical service or procedure or whatever you receive. That's in contrast to an all-you-can-eat buffet. You want 2 appetizers? We'll just go up to the buffet and take 2 appetizers. You want 2 desserts? Or you want a salad and no dessert? I mean, you can just go back as many times as you needed. And again, not that you would choose to take an ambulance to the emergency room to be admitted to the hospital, but on a Medicare supplement plan, which has a monthly premium, and that premium starts at about $130 a month for somebody who is 65. And the way most insurance companies structure that, they give you an 18 to 20-year discount off of the full premium, which will apply to you at age 83 or 85. And so for the rest of your life after 83 to 85, you'll be paying the full premium. And that premium will go up a little bit each year based on what the costs or the inflation factor in healthcare for that insurance company, for those people that it covers, involves. So back to that analogy, all-you-can-eat buffet, you're going to pay up front a little more maybe, or maybe a lot more than just going to an a la carte restaurant for which you can walk in and sit down at the table and put your order in. But you won't have to pay co-payments. So if you take an ambulance, if you have an emergency room visit, if you have inpatient care, if you have an MRI, you don't pay anything for that. If you get durable medical equipment, for instance, if you're on oxygen or use a CPAP, that's durable medical equipment, and all Medicare Advantage plans would say Medicare pays 80%, you, the member, are responsible for the other 20%. With a Medicare supplement plan, it's just covered. The other one is Medicare Part B drugs. Those are injections or infusions that you might get at your doctor's office, but it's not something that you go to the pharmacy and fill a prescription. Same thing. All Medicare Advantage plans in the Albuquerque market say Medicare is paid 80%, you're responsible for the other 20%. And those injections and infusions can include chemotherapy, of course, because that's administered by a medical professional. It can also, or they can also include injections into a joint, because a steroid injection, pretty inexpensive, and I've gotten away with not paying that, but I've also had to pay that. And injections into the eye for various forms of macular degeneration. Those are all Part B drugs, and Presbyterian Senior Care, as well as every other Medicare Advantage plan, covers those at 80%, you're responsible for the other 20%. But Medicare supplement plans, those are covered at 100%. The way your Presbyterian Senior Care or any Medicare Advantage plan works is you have a card. You present it when you go to the doctor, you present it when you go to the pharmacy to pick up prescribed medications. Many of those plans have some sort of over-the-counter benefit, and sometimes that same card you can use to go to Smith's or Walgreens or CVS to get things at a pharmacy that are not prescribed, like vitamins or antihistamines or, I don't know, first aid supplies. With a Medicare supplement plan, it works sort of differently. You will have to present your Medicare red, white, and blue card, plus your Medicare supplement card if you go to a doctor or a hospital or a clinic. When you're filling a prescription, you present your Medicare card and your prescription drug plan card, a different card, because you have to also have prescription drug coverage. That's not included in the Medicare supplement plan. That coverage, there are a couple of zero premium plans that are available, and if you're just taking generic drugs, for most people, those plans work pretty well for covering prescriptions. But one of the things that I, as an insurance agent, should do, and any insurance agent you speak to should also do, is to say, can you tell me which doctors you see? If you were admitted to the hospital, what hospital would you hope to be admitted to? And they should try to find a Medicare Advantage plan whose network includes all of those doctors. The other key difference, and that's a Medicare Advantage network, the other key difference with Medicare Supplement is there's no network. If you want to or have to go to Mayo Clinic in Arizona or Minnesota, if you want to or have to go to MD Anderson in Houston, you could do so on a Medicare Supplement plan. Very unlikely that you could do so on a Medicare Advantage plan. The woman I was speaking to yesterday said, oh, I went to MD Anderson. It's at Caseman Hospital. I said, well, that's a collaborative program that Presbyterian Health Services has for its cancer care. And their intent is for you to be confident in coming to Presbyterian for care for various forms of cancer, care and diagnosis for various forms of cancer. But that's different than going to MD Anderson. So long story short, you as a Presbyterian Senior Care member in October, that annual enrollment period starts October 1, and then you can actually change plans starting October 15th through December 7th. There are going to be 30,000 people who are on Presbyterian Senior Care whose coverage is going to expire on December 31st. And they'll have not only that annual enrollment period, but they'll also have, in case they don't know that their plan is going away, January and February to change. So there's those 2 additional months that they'll be able to change, and they'll be able to enroll in a different Medicare supplement, Medicare Advantage plan, or they'll be able to enroll in a Medicare supplement plan and a prescription drug plan. That, in essence, is what Presbyterian senior care members will face. And I'd just like to mention why the Medicare supplement availability is important. Usually, you're able to enroll in a Medicare supplement plan in your 65th birth month and then for 6 months after that. And only if there's what's called an involuntary disenrollment, and that will be the case for all Presbyterian senior care members, that you are offered a guaranteed issue, meaning no medical underwriting, should you choose to enroll in a Medicare supplement plan. So that's available to you. Typically, it's not ever available, and it can prevent people from changing plans. For people who are in their 80s, I talked to a very spry 88-year-old yesterday, and her cost for a Medicare supplement plan would have been about $226 a month and up, because the one that she liked was about $308 a month. So shopping for cost on what, frankly, I view as a commodity, the Medicare supplement insurance company operates on the basis of, if Medicare pays the claim, Medicare will transmit that claim to the supplement insurance company, and the supplement company will pay whatever it's obligated to under the contract, which is generally 100%, or the other 20% of that total cost. There are supplement plans that have an annual deductible of $247 that probably are a better deal for you in terms of the trade-off of you pay that one-time deductible versus you pay a higher monthly premium if you have a plan. Plan F, you may have heard about with Medicare supplement, that doesn't have that deductible. I think all of you here, myself included, could enroll in Plan F if we wanted to, but I don't think it's as good a, well, it's a better plan, but its rates are going to go up higher because anybody born after January 1st, 1955 can no longer enroll in that. And so that population too is going to get older and sicker. So that 17 minutes is my presentation on the lay of the land in terms of what awaits you if you're currently enrolled in Presbyterian senior care. And I'm happy to answer any questions that you might have. Yes?
With the supplement plan, you don't have out-of-pocket. I mean, they submit it like they would with an HMO?
Correct. And her question is, if with a supplement plan, do you have any out-of-pocket costs? The answer is, other than that, if you're enrolling in Plan G, which does have a once-a-year $247 deductible, no, you will not have any out-of-pocket costs.
So it's not a reimbursement type thing?
No, you won't have to pay at the desk of the clinic or doctor's office. They will handle the claim filing for you, sending it first to Medicare, and then secondly, Medicare will send it to the supplement company.
Thank you.
Yes?
For the supplement plan, do you pay an additional bit for a drug plan?
Yes, her question is, do you pay additionally for a Medicare prescription drug plan in addition to the Medicare supplement plan? The supplement plan definitely has a premium, and as I said, for this 88-year-old, it was from $226 up per month. There are zero premium Medicare prescription drug plans. There's 2 of them in the market, and for many people, those will work if they're taking generic drugs. The challenge for people like me, for example, I take 3 brand name drugs, and they're the least expensive brand name drugs, but I'm paying $40 a month every time I fill them at the pharmacy. And the zero premium plans may not be your best option for those with brand-name drug prescriptions. Yes?
Are there dental and vision plans you can get with the supplement?
Unlike Medicare Advantage plans, for which Joe Namath and his peers have always said, oh, if you want dental, if you want vision, if you want hearing aids, if you want an over-the-counter benefit or a grocery card, Medicare supplement plans don't have any of those. A gym membership is another one, though you have a very nice gym here. The gym membership they've begun to add, and the appeal of that is that you can potentially take classes over a computer or a tablet, or maybe your phone, but the phone is sort of small to see if you're trying to do a yoga class. But the Medicare supplement plans, most of them will have a gym membership. The United Healthcare one has dental, vision, and hearing discounts. But that's very different than you have a benefit that has, in the case of the hearing aids, you'll pay $700 or $1,000 for a $2,500 or a $5,000 hearing aid. Or you'll have an annual allowance for dental care of $1,200 is available on one of the plans that includes Presbyterian doctors in its network, or a small vision benefit. You can buy coverage outside of the supplement plan, but that's going to be an additional cost. So those discounts are something, but it's not the same as a benefit that's built into the Medicare Advantage plan. And I think you had a question.
Yeah.
With the supplemental.
Oh, so the woman in blue in the back.
Well, I'm curious. We all know that Presbyterian and Medicare Advantage is going away. Listening to you, it sounds like you really lean much more towards Medicare supplement plan than the Medicare Advantage. But my question is, are there other insurances in Albuquerque that are going to continue to have Medicare Advantage, or is this going away with Presbyterian? Is it out of the state?
No. This is where I'll have more information for you, and you'll get undoubtedly lots of information during the annual enrollment period. Presently, Cigna, which is now HealthSpring, which is owned by the Blue Cross plan in New Mexico, and United Healthcare include Presbyterian doctors in their network. United Healthcare does not include primary care doctors in their Medicare Advantage network, and they say they're going to add them. So both of those will be options that you'd want to explore. Given that 30,000 people are members of Presbyterian Senior Care, I anticipate that some other insurance companies are likely to add Presbyterian providers to their provider network. But they won't really announce that until they've signed an agreement with Presbyterian, and they'll certainly have to announce it on the 1st of October. They may not do so before then. Her question is, what determines the monthly fee on the supplemental insurance? When you call Presbyterian currently, I'm going to do a little detour, but then I'll come back to that. Presbyterian typically answers the phone like any other Medicare Advantage plan. You've reached Presbyterian Senior Care. We're a Medicare Advantage plan with a contract with the federal government. That contract can change year to year. With a supplement plan, there's no contract with the federal government. This predated the availability of Medicare supplement plans. But it really depends on what that insurance company's experience has been providing, paying claims on the claims, or paying payments on the claims that have been submitted by people who use that plan. The largest Medicare supplement plan in the country, and I wrote the proposal for United Healthcare to AARP that won it, the AARP Medicare supplement business in 1995. That plan has 30% of the market. Well, there's actually some benefit to being a big player, because if they have one or two very sick and very expensive members, they can spread those costs across all of their members. But ultimately, each of those Medicare supplement insurance companies is asking itself, we projected it was going to cost us this. Did it cost us more than that? And if it costs them more than that, they will in fact raise their rates. United Healthcare, as the biggest, has typically said that their rates go up 6 to 10% per year. But then 2 years ago, their rates went up about 25%. So it just, and I think that was influenced by what happened during COVID. But there's no guarantee that anybody's, well, we expect it's going to go up this amount, is going to be an accurate predictor for what actually happens. I subscribe to what I call a shopping, it's an aggregator or a shopping service, and I can get quotes from all, and any other independent insurance agent should be able to do this as well, can get quotes from any Medicare supplement plan that's licensed to do business in the state of New Mexico. From my perspective, it's a commodity, because all that we would care about is, do they pay the claims accurately? And if I encounter some sort of trouble with their customer service, would I be happy with their customer service? And we've all had experiences calling a customer service number and you think, I can't tell what they're saying. I think for the major Medicare supplement plans, and those are United Healthcare, AARP, Humana, HealthSpring, Aetna, they're going to have good customer service and they're going to do a good job of paying claims. So from my perspective as the agent, it's a commodity, and I would look at low price. But the 88-year-old I was speaking to earlier in the week said, well, I want to be absolutely positive that I get good customer service, and I've heard good things about AARP United Healthcare. Well, that's her choice. But it would be, for her, $72 more a month, and some people would say, well, gee, that seems like a lot. I mean, Blue Cross is $410 a month, so Blue Cross is not credible in terms of Medicare supplement plans. Humana, for her, was, I think, $350 a month. So I just look at the $226 a month option for a product that's essentially the same product as being very appealing. But everybody's going to reach their own determination about that.
What would be the benefits of sticking with the Medicare Advantage plan instead of supplements?
Well, think about your experience with whatever Medicare Advantage plan you've been on. If you had a large bill, if you went into the hospital and stayed more than a couple days, if you went into the hospital twice.
Roseanne's
Question.
Oh. So,
What is the benefit of Medicare Advantage?
thank you for asking for me the question. What is the benefit of a Medicare Advantage plan? And I was just saying that your experience may or may not have been one where the Medicare Advantage plan did a pretty good job of providing benefits to you. Now, there can be situations in which that's not the case. The Part B drugs, the durable medical equipment, prosthetics, but by and large, they cover, well, they're required to cover what Medicare itself covers, and they can offer additional benefits.
I noticed that prescription drugs are low with my Advantage plan.
Yep. He's noticed that prescription drug costs are lower with a Medicare Advantage prescription drug plan than they would be with a freestanding prescription drug plan. And that's become even more the case since Medicare restructured. Currently, You pay a deductible, usually for brand name drugs and not generics. You'll have an initial coverage period that goes from $0 out of your pocket, as well as what the insurance company is paying for prescription drugs. And once you and the insurance company have paid $2,200 a year, that's going up to $2,400 a year next year. But it used to be $8,500 a year. So that catastrophic coverage means you would pay nothing. The Medicare Advantage plan, covering doctors, hospitals, etc., and prescription drugs, can spread the cost of medications out over 100% of the spend, if you will. Prescription drug costs are about 15%. Certainly for some individuals, they're higher than that of the overall medical cost. But a prescription drug plan doesn't have that ability to say, well, by prescribing this medication, I'm keeping somebody out of the hospital, because they don't care about that. They don't pay for that. So as a result, some of the prescription drug plans have gotten, the freestanding ones have gotten fairly expensive.
And what if we don't know for sure if we should go supplement or advantage? What do you personally recommend for the average guy who comes in?
So the Centers for Medicare and Medicaid Services says I cannot, he wants to know what I recommend. The Centers for Medicare and Medicaid Services says that I cannot use superlatives to describe any plan. So my response to the best plan recommendation is I can't speak to that. The Centers for Medicare and Medicaid Services has a star rating system, and so the name of the survey is the CAHPS, and I don't know what that stands for, but some of you I've gotten a chance to fill out a survey. How well did you like your Medicare Advantage plan? Did you like the doctor? Did you like the pharmacy? Did you like the customer service? And those really are the three elements that go into the star ratings. Presbyterian itself, Presbyterian Senior Care is a 3-star rated plan. HealthSpring, just to give an example, is a 3-star rated plan. United Healthcare is a 4-star rated plan. I think they cheated because they imported that rating from some state that's not New Mexico, so I don't really trust that. But in answer to your question, I think you should look, and the agent that you're working with should answer the question, what's the best plan for you given the doctors that you see, the prescriptions you take, and the dosage and the pharmacy where you fill your prescriptions? Because often those prescription costs are going to take somebody away from plan A to a plan that has a much lower and more affordable prescription cost. I had one couple and they enrolled in one plan that left the market. I enrolled in another one, that plan left the market. And so, unfortunately, he sees 11 or 12 doctors. And none of those, not all of those, let me say it another way, no Medicare Advantage plan other than United Healthcare, which I don't particularly like, and I'll tell you why, covers all the doctors. And so he stayed with United, he went with United Healthcare. I don't like United Healthcare because their per day copay, if you're in the hospital, is $550. It went up this year from $350 to $550, so draw your own conclusions about that. I don't particularly like it. But in his case, I said, you don't have an option. He was denied because of medical underwriting. You won't have to face medical underwriting. He was fully prepared to pay the premium, which isn't zero, obviously, in order to have the flexibility of being able to see any doctor and not have much oversight by a managed care plan. Yes?
Paul, it seems to me that for those of us in the room who are going to be affected by what has happened to Presbyterian, when we go to enroll, I've played with, coupled with health plans. There are three fundamental questions: age, gender, and smoking status. Am I right?
Her question is how to, I'm going to paraphrase this, how do Medicare supplement plans develop their cost or their premiums?
Okay.
And her observations are correct. Age, gender, and smoking status. So if you set smoking status aside, the non-smoker rates are obviously going to be lower than the smokers' rates. Men tend to have somewhat higher rates than women on Medicare supplement plans as we age, because men tend to have more cardiac issues.
Oh, and one more thing I forgot. If a couple enrolls with the same plan, some of them offer a discount.
Her observation is also correct. Again, if a couple enrolls in a plan, and it can be a roommate situation, which is what Cigna Health Spring uses. It can be so if you're just living with somebody, or you can actually be married, they will typically give a 6 to 10% discount. In some, that's going to vary by insurance companies. Some of them say if both of you were enrolled in the same Medicare supplement plans, but others don't say that. And so there can be a discount available. And I quoted something today for this 88-year-old woman for United Healthcare, and then looked at what the book said, and the book didn't say that. So it's always a bit of an estimation process. You had a question.
I actually have two now. First, could you define underwriting?
Could I define underwriting? Underwriting, well, let me say what we encounter when we fill out an application. The application will say, did you just turn 65 or within the last 6 months, or do you have a guaranteed issue situation? Somebody on Presbyterian Senior Care could check that box and then skip the 2 pages of medical questions. But those medical questions are really going to be, do you have a diagnosis that's expensive for us, the insurance company? Do you have a cancer diagnosis, ALS, Parkinson's, Alzheimer's? Have you been in the hospital? That can be within the last 2 years, within the last 5 years. Have you visited the emergency room twice or 4 times within the last year? And some of them will ask the agent and the member to write, or the applicant, to write down all of their prescribed medications. Because some of the medications that you're taking now are predictive of problems that you currently have, but also problems that you're trying to prevent. So that was question 1. What is question 2?
Would it be safe to say between a supplement and an advantage plan that if you don't go to the doctor much, you don't have big old medical problems, that an advantage plan might be your better choice? But if you use heavy-duty meds, you go to the doctor a lot, you see a specialist a lot, you're going to end up in the hospital, in the ER, and all those things, and have MRIs, that the supplement would be your better plan?
Sure, I think that's as a general statement, she was saying if you don't go to the doctor very often, if you don't have much interaction with the healthcare system, your co-pays are going to be lower, and so Medicare Advantage plan, you'll face fewer of those on a Medicare Advantage plan. I will say that more than half of people on Medicare nationally are enrolled in a Medicare Advantage plan. So some of that has to do with marketing and Joe Namath getting out there saying, don't you want dental benefits? Would you like a grocery card? But some of it's also the consumers appear to be pretty happy with those plans. And the government started off paying 85% of the average Medicare cost to insurance companies that offered Medicare Advantage plans. Well, the insurance companies, being insurance companies, learned how to game the system, so now they're paying about $135% of the Medicare cost. And so I fully anticipate seeing some reductions in those additional benefits, which they're doing I'm not gonna say it's all profit, but they're taking from
Yeah.
monies that they're not spending on healthcare. How about that? So I'll give myself as an example. I had a cancer surgery. The preceding visits with the surgeon, 2-day hospital stay, which was really kind of short, and this follow-up visits, it was about a $78,000 bill. I paid 2 days of hospital inpatient copay, which was at that point $250 a day. So from my perspective, and each of you is going to have your own calculus on that, I paid $500 for a $78,000 interaction with the healthcare system. But there are people for whom that's not the case. And those people, particularly those who are concerned about seeing very specialized doctors like MD Anderson or Mayo Clinic, that are concerned about having complete freedom of which doctors to see, and you can certainly continue to see Presbyterian doctors on any Medicare supplement plan. In the lessened oversight, there's starting with authorizations, but there's no authorizations on Medicare itself, except in a couple of small instances. So it's going to vary depending on what your experience as the consumer has been. If you've been happy with Presbyterian Senior Care or whatever Medicare Advantage plan, you're probably going to want to continue on it. I've talked to a woman who said, I was in the hospital twice this year and I got all these co-pays and I just don't want to have to worry about the co-pays. I want a supplement plan where if it's covered by Medicare, they're going to pay everything. And so she switched to a supplement plan. That may be good advice for other people or maybe not. If you're happy with an Advantage plan, and 50+% of Americans are, you'll probably stay with an Advantage plan.
Are there any that are going to be covered by Presbyterian?
Well, these two, United Healthcare currently and HealthSpring currently, include Presbyterian doctors and facilities in their network. I would anticipate that there would be other ones that would include Presbyterian providers in their network, but I talked to Humana yesterday and he said, well, we're talking to them, but they don't know.
What about Blue Cross Blue Shield? Can they carry the advantage?
Yes, Blue Cross, I'm a Blue Cross Blue Shield member. Blue Cross Blue Shield has PPOs that include the out-of-network coverage for Presbyterian doctors and hospitals. But to dive a little, several questions about Blue Cross Blue Shield. To dive a little bit into the PPO, with Presbyterian Senior Care, you have in-network benefits. You see any doctor or hospital or facility that's covered under the Presbyterian Senior Care network, and you have a very predictable copay. With a preferred provider organization or PPO, you can go outside of that network, but you'll inevitably pay more. So yes, currently on a Blue Cross Blue Shield PPO, you can see doctors at Press, and that's probably not a bad deal, because if you pay not $20 for a specialist on the Blue Cross plan, but you pay $50, well, from a second opinion perspective, that might be just fine with you. But heaven forbid you're actually admitted to Presbyterian under a Blue Cross Blue Shield plan, because it's the facility-based care, the inpatient admissions, and potentially the outpatient surgery that could be much more expensive. So you're going to want to look very carefully at the details, have an agent help you with that if you choose to. Roseanne, you had an observation?
Just to repeat the question again, because we can't hear the question.
Okay, so I'll try to do a better job of that. She wants me to repeat the question, so I'm repeating her request to repeat the question. Yes?
I'm retired from UNM. Do you know whether or not UNM will be offering the same options as everyone else will get in open enrollment?
So she's retired from UNM and she wants to know if UNM will be offering the same options. UNM the Retiree Health Authority, APS, large number of retirees have worked at those places and have their insurance, and the agent, don't understand how those differ. They, as employers, have the ability to build in prescription drug benefits in a different way, potentially on the supplements. But in my experience, Retiree Health Authority plans, which are comparable to those that are zero premium available to the general public, usually have a premium associated with it. So they're just different. And so I would encourage you to go to the UNM retiree office. I'd encourage you to go to Retiree Health Authority or whoever your former employer is and ask that question of them. What's going to be available to me? Yes?
It's retiree health authority. Is that the same thing as if you're saying it's through being a state employee?
Correct. The Retiree Health Authority covers state retirees, as I understand it. But APS and UNM are separate. And somebody who's got federal insurance, I've never succeeded in having a successful sale with them because they've got great insurance, and what's available to us under Medicare isn't typically as comprehensive. It may have a premium, and that may, well, I actually have one client, because as a federal government employee, you can suspend your participation in the federal benefits plan and then bring it back to life later on. That almost never exists for anybody else. So the concern that you as a UNM retiree or a state retiree would have is, if I were to leave that benefit program, could I get back in? And that's a question you would have to ask them. Generally, so her question is, how would an agent like me, an independent insurance agent, or potentially a captive agent, work with somebody who's a UNM retiree, a Retiree Health Authority recipient, an APS retiree? And the answer is, I or any other insurance agent that sells these policies that are available to the general public could tell you about the benefits of those policies and what the premiums are. Generally, those premiums are zero. But I don't know anything about the benefits at the Retiree Health Authority. So essentially, I would be equipping you to have a conversation with the Retiree Health Authority, in which you'd say, well, Plan A here has these benefits. How would my retiree health benefits compare to that? And then you'd want to do a careful comparison, because they could be equivalent, and you could save some money, meaning you wouldn't pay the Retiree Health Authority or the UNM retiree plan premium, but they could be less. And so you really want to make sure you were making a choice that you'd be satisfied with forever, because you probably can't get back into that if you were to leave it.
You guys said earlier that the United Healthcare Advantage Plan does include the Presbyterian network of doctors. Are there primary care doctors on that network?
So his question is, are primary care doctors at Presbyterian included in the United Healthcare network? Currently, there are not. United Healthcare, which is a big player in the Medicare field in New Mexico, has said it intends to come to agreement with Presbyterian to add the Presbyterian primary care providers. So that's something I would anticipate they would announce and promote probably prior to October 1st. Yes, a question, in fact.
Yes. Right now, is the Blue Cross Blue Shield plan available for someone when this change takes effect, for someone in their 80s? Because I have had a Medicare Advantage plan, but this past year and 2 years, I've had very high expenses. And so I'm wondering if it might be better to what am I eligible to get into?
So her question is sort of a complex one, and I'm going to try to paraphrase it. She's asked, as somebody in her 80s who's been enrolled in a Medicare Advantage plan, what's available to her. Medicare Advantage plans and Medicare prescription drug plans cannot do any medical underwriting. You're very healthy, you're very sick, it doesn't matter. You can apply for and become a member of any of those plans. They cannot discriminate against you because you're not healthy. Medicare supplement plans, that's not the case. Well, Blue Cross had the first one, and she asked a question about Blue Cross. Medicare supplement plans started, oh gosh, in the 30s, I think. It's a long history. Those Blue Cross plans, or any Medicare supplement plan, can, for the average person, say, here are the 2 pages of questions that you've got to answer for me about your hospital experience, your ER use, your prescription pattern, whether you have any diagnoses that are going to be expensive. So long story short, Blue Cross or any other Medicare Advantage plan or prescription drug plan can't pay any attention at all to what your past experience and costs have been. The supplement plans can, unless you're a Presbyterian senior care member and want to take advantage of that guaranteed issue right that you will have, because Presbyterian is involuntarily, it's not your choice to be disenrolled, they're just doing it to you.
I would just like to let you know that the last few days I have received a telephone call directly to me from a lady that is very pushy, not friendly at all, stating that she is from the Medicare,
Probably the Medicare department.
and wanting me, telling me that I owed $1,000 for my recent hospital stay in June and $2,000 in July, and the bill has not even been sent out yet. I found out this morning that is a scam.
So she's saying she's getting calls from insurance agents telling her something or other. In her instance, she's being told, because she had a hospitalization in June, that, they must somehow have figured out that she had that hospitalization. She was going to owe a lot of money for that. The thing, and I get these calls as well, the thing that you should know is it is not legal for someone to call you without your permission. For me or any other insurance agent to speak with you, I have to have your permission, and I get permission by electronically or a hard copy requesting you to review and sign a scope of appointment form. That limits me in terms of what I can speak to you, and it is required of any insurance agent that's speaking to you about Medicare. The choices on that are Medicare Advantage plans, Medicare prescription drug plans, Medicare supplement plans, and ancillary plans. So you can check a box or not check a box, and if you don't check the box, the agent is then required to say, well, if you want to talk to me about that, we have to fill out a new form so that you're giving me permission explicitly to talk about that, and I, the agent, have to hold on to that form for 10 years. I talked to people, and Roseanne Tenna worked for Presbyterian Senior Care for many years. She's in the back of the room. Agents aren't supposed to call you. And they are supposed to get your permission to talk with you and then ask questions. Have I met your need? Do you have other questions of me? These robo-caller insurance agents typically are saying, what's your zip code, what's your address? And they're enrolling you in a new plan as they're talking to you on the phone. That's completely illegal, and yet they're still doing it. Yes?
Presbyterian has
Her question is, does Presbyterian have a PPO plan? That actually went away last year. Yes, so Presbyterian Senior Care is currently just HMO plans. And I think there's one HMO point of service plan as well. Now Roseanne's saying no. DSTEM. So that's a great point. Thank you, Roseanne. Presbyterian is leaving the Medicare Advantage market with a giant asterisk. Presbyterian Health Services has a contract with the State of New Mexico Health Care Authority, which is part of the Human Services Department, to administer the Medicaid plan, Turquoise Care. I think it's the largest Turquoise Care contractor in the state. People who have both Turquoise Care and Medicare, and that can include people 65 and older, as well as people who are disabled and on Medicare because of their disability, will continue to be able to get a Presbyterian, they won't call it senior care, they'll call it something else, Medicare Advantage, dual special needs. So it's a Medicare-Medicaid combined plan. There's about 16,000 people in that pool. Those plans will be continued to be offered at least through the end of Presbyterian's contract with the state. So they could extend that contract with the state or not. That's not today's question. Yes, you have a question.
What is the best way to make contact with an insurance agent? I mean, I realize you have one, so.
Yeah, you may have any. Your question is, what's the best way to make contact with an agent?
I mean, somebody that's, viable and that you trustworthy. I mean, the whole area is just so.
So her question is, what's the best way to make contact with somebody who's trustworthy? You may have a strong relationship already that you're quite happy with an insurance agent. And in that case, I'm not trying to take that relationship away from you. If you feel like you've gotten good service and good advice from an insurance agent, please continue to use them. I would encourage you, if you're looking for agents, to look for somebody who is an independent agent, because there are also what are called captive agents who can only sell the Blue Cross products or can only sell the Humana products. If you talk to one of them, you'll probably get great advice about those products, but if you want to know about all products, you should be speaking with an independent insurance agent. I'm a member of the National Association of Business Insurance Professionals, and so I'm sure there are some captive agents who are in that organization, but in general, there are national associations, there are state associations of people who are independent insurance agents, so that's another way to do that. Or talk to a friend. Ask a friend if they have an insurance agent that they've been well served by, and if that agent is an independent insurance agent, because that's really the key thing from my perspective.
Well, the people that I know have not had an insurance agent. I signed up when I was eligible for Medicare, so I've never used an agent. So there's that question. Then my second question is, how are the agents paid?
So she has two questions. She's never had an insurance agent, and if she wanted to look for one, I would just advise you to look for one that's an independent insurance agent, so you're going to get information about multiple plans. She asked how insurance agents are compensated. This is an educational session. I've held up these two books because I was wanting to talk about the the Medicare Advantage provider networks that currently exist that include Presbyterian providers. And it's just these two plus Blue Cross PPO. I think there's going to be others. But this is an educational session. Other than that reference, please forget it. I even said anything about it, that healthcare has a $550 a day inpatient copay. That was benefit information. I shouldn't have said that. But this is educational. I do educational conversations all the time, and any insurance agent should be willing to help you understand what your options are and to help guide you to an option that's going to include all the providers and make the prescription drugs that you're taking filled at the pharmacy you're filling them at affordable. And if that insurance agent sells you a policy, the insurance company pays the premium directly to the insurance agent. I've had people who said, well, you're so helpful, I want to take you to dinner. Technically, I can't do that. I certainly cannot accept cash. It's just illegal. Yes. Yes.
Could you tell us the difference between a supplemental plan and an advantage plan by bullet points, the main issues?
Her question is, what are the main differentiators between Medicare supplement plans and Medicare Advantage plans? Okay, here goes. Medicare Advantage plans generally have no premium, and a Medicare supplement plan always has a premium. Number two, Medicare Advantage plans always have a provider network, though some of them, preferred provider organization plans, allow you to seek providers that are outside of the network if you pay a higher copay. Medicare supplement plans, you can see any doctor, go to any facility or any hospital that accepts Medicare. Nationally, 95% of 95% of physicians and providers, and essentially 100% of hospitals accept Medicare nationally. Medicare Advantage plans and Medicare supplement plans are both supposed to handle billing and claims payment for you. You present your cards when you check in, and whoever that provider is that's providing the service is going to bill the right organizations. So that's not really any different between the two of them. Medicare supplement plans typically don't have much quality oversight. I mean, they're rated on their quality by the government, but they don't have what's called utilization management to the same extent. Medicare itself, and as a result, the Medicare supplement plan, is going to look, are you making progress? So first of all, they're going to look at, is it still medically necessary for you to be in the hospital? And if they feel it's not, they're going to make a recommendation to the hospital that you be discharged. If you feel you're being discharged before you're ready to be discharged, you could always request an emergency reconsideration. But that happens much more often on the Medicare Advantage side than it does on the supplement side. The supplements, because what happens when we're in the hospital, if we're really pretty ill and need rehabilitation, we're going to be discharged to a skilled nursing facility or a rehab facility. And the way Medicare works is called the 3 midnight rule. You have to be in the hospital 3 midnights in order to trigger the skilled care benefit period, which brings that rehabilitation benefit to you. Medicare Advantage plans can say, yeah, they were just there 1 night or 2 nights, but they need to rehabilitate, so we're going to cover that. But under Medicare supplement, that rule is definitely going to be applied. So it could be somewhat more difficult to get care at a rehab facility. What other differences are there? Medicare Advantage plans do include prescription drugs by and large. The Presbyterian Senior Care Plan 1 doesn't include drugs, and for people who have TRICARE for life or get their medicines at the VA, there are plans that will not have the drug benefit and will have some other sort of additional benefits that compensate for that. Medicare supplement plans, you have to get a freestanding Medicare prescription drug plan, or you'll be penalized. And so at that point, those zero premium plans for somebody who's not taking very many medications or any medications, it's really important to enroll in one of those because you're going to accrue a little tiny penalty every month. Well, in 10 years, that's, if you need a prescription